Let's talk health now. The Coordinating Minister of Health and Social Welfare, Professor Ali Pati, says Nigeria's health sector accounts for 3% of the economy, compared to 14% in the US and 10% in Organization for Economic Cooperation and Development countries. The minister is optimistic that as the country grows wealthier, the health sector will make an increasingly significant contribution to Nigeria's GDP and job creation efforts. The coordinating minister made this known at the steering committee meeting of the Presidential Healthcare Value Chain Unlocking Program, chaired by the coordinating minister of the economy, Wale Edun, at the Federal Ministry of Finance in Abuja.
Health can be a contributor to our economic growth. U.S. health is the second largest chunk of the U.S. economy, almost 14%. In most OECD countries, it's almost 10%. We're at 3%, but as we grow wealthier, health will be a larger contribution of our GDP. It's also a job creator across the sector, and there are many jobs that can be created, and there's also an economic value around it. And I think that's what informed the wisdom of Mr. President to anchor this initiative as a deliberate measure so that we unleash the healthcare value chain, looking at policy measures, regulatory measures, financing measures, but also what the private sector can do, and to do it collaboratively between the public and the private sector.
The exchange rate is competitive for manufacturers now. The incentives are against importing, and they're all for producing domestically. And as we just look forward to the constant stream of announcements, and you know they are becoming regular. The Total announced a big investment. Shell just announced an even bigger investment. And of course, I know so many others in the manufacturing sector saying they have a $1 billion investment program in Nigeria. Even domestic manufacturers. The same way that China was producing for the world, Nigeria should be producing at least for Africa because of the economies of scale.